So actually, let's start with you, Carolyn. So why don't you tell us a little bit about yourself and your journey?
Okay. Hi, everybody. My name is Carolyn Edward. I am a 20-year, roughly, glaucoma patient, diagnosed at age 38. I've got one of those tricky cases where, despite some great doctors over the year, I have had multiple surgical procedures, multiple drops. Basically, if a drop has shown up on one of those lists, I've been on it at one point. I've still got very functional vision. I've lost a little bit of central vision in one eye and a little bit in the other, but overall really thankful for the doctors, for GRF. I've been involved with them for quite a number of years, and I've gotten a lot of support from them.
Great. And Florian, why don't you introduce yourself?
Hi, everyone. My name is Florian Nedelchik. I live in San Diego, and I've been diagnosed with glaucoma in 2024, so not that long ago. But I knew that I was a glaucoma suspect for a while before that, but until I had a retinal detachment in 2023, this never really came up. So after the retinal detachment, it was repaired successfully. However, a year after that, I was at a follow-up appointment, and my doctor noticed that my pressure was a little bit elevated, so they sent me back to my regular ophthalmologist, and then I was essentially told that I need to find a glaucoma specialist and probably look at surgical options. And so that journey in itself was a little bit stressful because I couldn't find an appointment in a timely manner, and I started researching, kind of frantically. And I came across GRF in particular, and then I found actually a doctor through GRF, one of the doctors that was at an earlier summit, and I reached out to their office. They were able to see me fairly quickly, so that's how my journey started. I've had a couple of procedures, probably 3 or 4 procedures, surgical and laser, and I'm doing pretty good right now, but again, it's a lifetime commitment, and it requires a lot of follow-up and education, so that's why we're here to help you guys and us also with this journey.
Wonderful, thank you. So Dr. Barsegian, let's start with you. What steps should a patient take when they're preparing for their doctor's appointment? Let's start with a newly diagnosed patient. What steps should they take to prepare?
So I recommend coming in with a very clear list of medical conditions that you have, a clear list of medications that you're taking, including creams, nasal sprays, etc. We talked about steroids earlier. We need to know if you're on a steroid nasal spray. That can cause spikes in eye pressure. If you have a heart arrhythmia, we'd be very careful about putting you on a drop called Timolol. So we need to know all of that. If you have old optometry or ophthalmology records, I do recommend trying to get us to that, and trying to get those to us in advance. I actually prep all of my charts in advance, and I do like to look at the records if I have them, just so I come into the room and know your history. That would be better for both of us. And if you are on any drops, bring the drops in with you so that we're not playing a guessing game about which color top you're on, what time of the day you're on, how often you're using it. And just come in with your list of questions and give yourself grace. It's okay if you don't, remember all of the questions or that you wanted to ask and such. I mean, you can always call the office, and I'll call you at a later time and kind of discuss anything that you'd like to discuss.
Dr. Pickering, similar question to you, but if a patient wanted to switch to your service, how should they prepare? What would you want them to bring into their appointment?
I echo everything that Dr. Barsegian said, and the old records are absolutely crucial. Whenever possible, I like to ask patients, when you were first diagnosed, what was your highest pressure before you started treatment? Because it really guides me in knowing how much I need to expect, for example, to lower eye pressure, what classification of glaucoma, when were they diagnosed, how long have they had this, prior treatments. And some patients remember, but to be fair, many of us don't. So I do tell them, if you can get like the first records, if possible, that's really helpful. And of course, the intervening tests to monitor to see once they're on treatment, have they been stable? If not, then I know I've got to do some work right up front.
Could I add into that before I forget? I think I learned, this is my third patient summit. I attended in 2019. I happen to live in San Francisco. I've moved a lot for work, and I learned at that conference how important it was to bring your old records. And I think I was already on my fourth, maybe my fifth specialist. I've had 7 or 8 now. And so what I've started doing, if I need to leave somewhere and move, I ask for a printed copy of my records before I leave, and I keep one main file. So if I see a new specialist, I bring it all to them. My last first appointment at my new specialist about a year ago, he kind of looked at me a little cross-eyed, but then was very appreciative. I said, look, read through it, toss what you want, but he really did appreciate it and felt like it was proactive, and it's not something I would have thought of. So I would recommend that if you're in a position like I was where you may need to move or just want, to change specialists for whatever reason.
So actually, let's talk about that. So it's kind of a funny question, but how do you break up with your doctor? Like so this is for both the doctors as well as the patients. If you wanted to get a second opinion, or maybe if you were unhappy with your care, how do you break up with your doctor? And doctors, is that something that you're going to take personally?
Well, absolutely not. I think it's quite appropriate to ask for a second or even a third or even a fourth opinion if you feel that's necessary. I keep a very open mind, and as we have mentioned throughout today's sessions, you have to be comfortable with whoever is your caregiver. And if it's not a good fit, that's fine. Just find someone else. We understand that. We just want to make sure that you're well taken care of. I would hate it if someone said, oh, I hate this practice, I hate this doctor, I'm done. No, reach out and say, hey, I'd like to find someone else, and we're happy to refer you, we're happy to send your notes. We understand that occasionally people can't get to us because of transportation. It doesn't matter. We know we can't necessarily see everyone and that it's not always a good personality fit, and that's fine too, for whatever reason, if you want a second opinion. I often, when discussing complex cases, will offer patients a second opinion, especially at the first visit. I'll say, I just gave you a lot of information. I'm recommending treatment that is a little bit startling. I'm happy to refer you to my colleague in a different institution. And I think it's important for patients to know that you have that confidence in your diagnosis and in your treatment that you're happy to send them to another doctor as well. And we will do that. We set it up and send you to someone else. Yeah.
You agree?
Yeah, no, 100% agree. I love second opinions. I love third opinions. I love fourth opinions because I think Dr. Pickering will agree with me. We're always trying to learn. And we learn a lot. We learn a lot from you as patients. We learn a lot from other physicians. I just had a case. I did glaucoma surgery for a patient who had only one seeing eye, and we were trying to save that eye. And I basically saw him every day for a week. We had some challenges. Sometimes the pressure was too low. Sometimes it was too high. And his wife called me and kind of very timidly said, we're looking for a second opinion. I was like, great. I know exactly who to send you to. I did my fellowship at UCLA. My mentor saw him at UCLA and said, you did everything well, just give it time, it'll be fine. And then the patient's now fine and really grateful and wants to see me. And there's no ego with this. We have no ego. And if anything, it'll help you to tell us because we'll speak to the doctor, we'll send over the records, we'll explain the situation, and then, we're here for you in any way that we can be.
Have either of you had to, okay, Carolyn, you've moved around a lot, right. So you obviously have an excuse for moving on, but have either of you sought out second opinions or third opinions?
I have. In fact, when I was kind of at the beginning of the journey and I had to make a decision as to what type of procedure I was going to do, the opinions were quite mixed. One of the doctors said that, you need a trabeculectomy. That's the only thing that's going to bring your pressure to where it needs to be. I was hesitant, so I went around, to other doctors, and eventually I decided that I'm not going to do a trabeculectomy. I want to exhaust every possible MIGS procedure before I go that route, and it worked out, in the end. So again, it's something that it's an art also, not just a science. So I think every person's different, and don't be afraid to seek that opinion and go out of town if necessary to see a doctor in a different city and be comfortable with whatever decision is being made. It's you and your body.
So in that vein, Carolyn, Florin, how do you build trust with your glaucoma specialist?
I think, it's very much a two-way street, and I've had some great specialists. I've been really lucky. I've had good insurance. Again, when you move and you start to meet new doctors, and I don't know if it's fair to call it an interview, but you're basically, it's a kind of a two-way interview. You get a sense for, do they have the knowledge to help with a complicated case, which, let's face it, a lot of us here in this room, if you're here, you probably have a more complicated case or you're very invested in healthcare. So, to me, I try to be prepared. I know that I don't have all the answers. I also know that the doctor doesn't have all the answers, and if they thought that they did, then I probably would question a little bit. No, I've been lucky in terms of eye specialists. I've not ever had to break up with one. I've had several of the best ones offer a second opinion because I've needed a couple of major surgeries, and they've said to me, if you want to see another specialist and get another opinion, I'd be happy to refer you where you can find one on your own. And I've been lucky. I haven't had to do that. I've really trusted the advice, but I wouldn't hesitate to if I felt like I needed to.
Yeah, I would agree. And I haven't had to change specialists, but I see 3 different specialists. I have a retina doctor, I have a glaucoma specialist, and a regular ophthalmologist, and actually an optometrist that I see from time to time for glasses. So yeah, it's important to keep them all in the loop and to have, like Carolyn said before, a copy of the records. They appreciate, looking at these visual fields and being able, but you need to have continuity of care and make sure that, you have sort of one quarterback that knows kind of everything about you, and then you can seek opinions as needed. But yeah, absolutely. Sometimes it's overwhelming to keep track of everything, but it's good to have, someone that is in charge of your primary, care in this case.
Sorry, can I just something in that vein? So completely fine for you to get multiple opinions, but I think this was discussed before. You really should pick a home. So, and kind of pick a place where you are comfortable getting, your follow-up with your glaucoma care and getting like a new opinion every 2 months in different places and kind of, because we've all been trained differently. We all have different approaches. Doesn't make us right or wrong. It's just how we were trained to and how we practice medicine. And so I do agree with Florin, having kind of a home base is very important.
Great. Terry, question for you. We've been talking about building trust and learning to advocate for yourself. So if a patient feels like they're being rushed through an appointment, or if they feel like they're not getting enough communication between maybe you or people in the clinic and themselves, how can they go about advocating for themselves in that way?
That's a great question. It's a question I think is going to come up more and more as the years go on, because we are facing a physician shortage in every field of medicine, not just in the United States, but globally, because there's a generational retirement that's happening of all the baby boomer doctors, and that was a huge cohort of physicians. So we're trying to see as many patients as we can, because we're here to serve people and we don't want people to suffer and be waiting. But there's going to be longer wait times, and there's going to be concurrently less time per patient with a doctor. So being prepared as the patient for the appointment is helpful, but if it's a very complex case, if you have a lot of questions, it's absolutely appropriate to tell your doctor, is there a way for us to communicate more? I have some more questions. And for us, and depending on your healthcare situation, you may have a patient portal. We don't, but we also have email. You can always call us and occasionally even set up a time. And I'll say, well, what's a good time for you that I can call you back? Or let me review, if you come in with this many records, let me call you back after I've reviewed them, or we can set up a time. So I think that is appropriate, just to communicate that you'd like to have a bit more information, have specific questions, and set up a format that works, whether it be email or a phone call, and the time that works.
So recently I had a conversation with my father about his latanoprost, and he has glaucoma in just one eye, and he's been complaining to me. He's got a little bit of a headache on just that side where the drop goes. And I'll say, well, Dad, call your doctor. No, I don't want to bother him. I don't want to bother my doctor. Well, there are other options or other things. No, it's fine, I can deal with it. what would you guys tell me to tell my dad?
Tell Dad. We want to know. We want to know if you're having difficulty with your eye drops, because we've got lots of options. You don't necessarily need to suffer. And more importantly, the concern is compliance or adherence. If you're getting a headache, the temptation may be to say, oh, well, I'm not going to use it today because I'm busy today, or I'm going to skip tonight because, I know I have a big day tomorrow. That's not in the long term helping you manage your condition. So let us know what's going on. We can try to sort it out for you. It may not be related to your glaucoma drop. There may be something else health-wise going on. And occasionally, we do diagnose other health conditions, such as a stroke. Not that that's happened, but I'm just saying, reach out. Let us know if you're having a problem, because we want to know. We want to help you. So again, there's phone calls, emails, and we'll respond.
Same thing?
Same thing, I agree wholeheartedly. I mean, sometimes when there's a headache, it could also be because the pressure is high and latanoprost isn't helping, and so that's also something that we would want to know about. So feel free to call, and we'll, we want to know, is basically the point for sure.
Okay, thank you. Carolyn, what is the Aspect program? What can you tell us about it?
Okay, the Aspect program is an educational and training program sponsored by Prevent Blindness. It is open to patients as well as researchers, sometimes newer physicians or medical students across all eye diseases. So you would not be in a group strictly with glaucoma patients, at least in the main cohort is what they call them. It is an online training course. It lasts, I think it was about 6 months. It was 1 2-hour meeting, and the times are determined kind of by consensus of the group. Our meetings were after the work hours in most of the country. I think it was at 6 or 7 o'clock at night. Sometimes people are doing it feeding a baby, on their lap, or whatever the case may be. Fairly informal, but the goal was to educate all of us about the importance of eye health, about the importance of advocacy, both for yourself as well as there was actually some people that were interested in government advocacy programs, things of that nature, some people that were in public health, a few of them. So it was a mixed group. I would say it was probably 3/4 patients. I got introduced to it thanks to Nancy, wherever she is, who asked if I would be interested, and I had just retired from some interesting years in retail during the pandemic, and I'm like, absolutely not. I don't want to do that. I don't think I said that to her, but trust me, that was my thought. Like, do I really want to go to school and spend more of my time learning about glaucoma and eye health? I've been a patient for a long time. I learned enough. I will tell you, I was fascinated by the program. For those of you who have enjoyed the networking and support of this group, it's more of that. There will be time when a couple of people, and it's all volunteer basis, will offer to share their story each week. So they will give you some advice and guidance how to craft a 3 to 6 minute story about your glaucoma journey or your eye health journey. You can say you're open to feedback. You want people after you present to share with you. That could be terrifying, yes. Or you want people to email you feedback, or you just prefer not to have feedback. You want the practice, and that's all you want to do. But then there are breakout groups. So you can meet then in a smaller Zoom room with 5 other glaucoma patients, for example. I really enjoyed it. Every other year, on average, they've then gone to Washington, D.C. and had a day of advocacy. I think it happened just this week. Somebody, I think Glaucos, which is a sponsor of that as well, was telling me about that. It was incredibly informative. And again, these people that you've worked with for 6 months, you're then getting to meet in person in Washington, D.C. So it's a free program. I'd highly recommend it. A couple of the staff at GRF have also been through it, or you're welcome to reach out to me. I'm sure GRF could give you my contact info if you just want to learn more. But the Prevent Blindness website has some basic information as well as information on how to apply for the program.
Oh, wonderful. A question for all of you. Why is advocacy so important? You want to start?
On the personal or patient level, I think it's important for advocacy because you want to be involved in your own care. I like it when patients ask questions and are involved and invested in their own care. It shows me that, they probably will do well because they want to do well, they want to take care of their health. So, and it also gives a better outcome. So I support that on the patient personal level. On the more social or community national level, we need help now because all of the public health institutions, research institutions are under a lot of economic pressure. And so we don't want to be forgotten in eye care and in glaucoma care.
Absolutely. And as I understand it, aren't the Medicare providers also allowing for comments right now for MIG surgeries? I think I heard something related to that. So that I think that's another situation where you could you could call your Medicare provider, or you can write a letter and advocate for yourself if you feel like your coverage is being denied for the wrong reasons. Is that right?
Well, I think we have to do that. We do that all the time. I don't
Oh,
know.
okay. Well, yes,
Unfortunately,
prior
yeah.
authorizations.
I will say also that Prevent Blindness then includes you kind of in their ongoing outreach efforts and,
great.
lobbying efforts, for lack of a less descriptive word, I guess. And they will share opportunities like that to reach out to your Congress people. They'll give you that easy link where, you're basically filling in your name and address and your representative, and it's really easy to communicate on behalf of eye issues in general. So that's another way to continue helping.
I've seen opportunities like that on LinkedIn where they give you, and I think it's AVER as well. They're a lobbying organization for the Hill that will advocate for NEI, increasing NEI's budget, or if there's something coming through that might politicize in any way NIH. They do provide like form letters, and they provide like webinars and stuff so you can educate yourself on that if that's something that you're interested in. Did you want to add anything?
No, I think as far as advocacy more broadly, I think, you're your best advocate, right? So you need to be invested in your healthcare and, follow up with your doctor and ask these questions, and don't be afraid to look up stuff, to read about stuff, to, even here, we've learned about all these new surgeries and new procedures and even new forms of treatments that are coming on. So I think being informed is most powerful, and I think that your doctor would appreciate if you ask intelligent questions and if you're just invested in your care. And I think it's important. Just leaving things be is not the answer. I think you need to stay on top of your care, because this is a lifelong commitment. This is not going away. So.
Yes. So, Dr. Barsegian, what advice do you have for newly diagnosed glaucoma patients?
Well, I think initially it's completely appropriate to feel very anxious and overwhelmed. And truly, if you are feeling super anxious, there's zero shame in even speaking to a mental health care professional about it. The first part, I think, is it's very hard to accept that, you have a lifelong condition, and now you will have to be on treatment for the rest of your life. And even, just remembering to use an eye drop once a day, and now you have to kind of reschedule your whole life and try to figure out how you're going to figure this out and do it at, approximately the same time every day and not forget. And, as our days get busier, it's harder and harder to introduce new things into our routine. And just something even as simple as that, I know can take months to really kind of become adjusted to. When my patients come to me for the first time newly diagnosed with glaucoma, they ask me a lot of questions. Of course, am I going to go blind? What are the chances that I'm going to go blind? And initially I say, look, the chance if this is diagnosed early enough, of course, if the pressure's sky high and we have to do emergency surgery, that's a different situation. But for the most part, if I'm diagnosing this as a chronic condition for the first time, I tell them, your disease will tell me about itself over time. I cannot predict the future perfectly, but I can tell you that for the most part, if the disease is diagnosed early, then you will have functional vision at the end of your life, and that's our goal. And that I will be super invested and will be as honest with you as I can be. I think Dr. Pickering will also agree with me. Sometimes, tests fluctuate with glaucoma, right? And we almost don't want to be too aggressive, but we don't want to, let the disease worsen either. And so there's kind of this balance, this delicate balance that we're always trying to maintain, while also taking into account our individual patients' personalities and stress levels and anxiety levels. And also understanding that, you're the one doing the work. You're the one who has to go home and use eye drops. You're the one who has to, come in and see us. And of course, we love seeing you, but you have to do so much for this disease, and it's such a lifelong commitment that we try to kind of take all of that into account when we come up with a treatment plan. And of course, if you have any questions, let us know. I will say in the beginning, it's very, very normal to be overwhelmed. I have found that as patients kind of get to know me, we see you pretty frequently in the beginning, and then every few months, if you're stable, you become more comfortable as you are comfortable with your clinician.
Would you have anything to add, Terry?
Absolutely. That was a beautiful way to describe it, Dr. Barsegian. You have to allow yourself a period of adjustment. Whenever your life situation changes, you will have, as time goes on, new diagnoses, new living situations, things change. And, take some deep breaths, learn, communicate, advocate, and just keep moving forward. And make sure you have a good communication, good rapport with your doctor. And, in my lecture earlier, one of the things I said is we invest a lot in diagnostics versus therapeutics. I didn't mean to say that we don't treat patients, but especially the first year or two, we're going to test you a lot, and it's going to be a burden. Nobody likes a visual field. Trust me, I hear that about 20 times a day. But it's critical because it is subjective. It is not objective, and we want to really optimize that test to see where you're at, what is an accurate test, to make sure that we're getting reproducible tests and that we have an accurate idea of where your stage is, and so that we know what and where you are in the course, in your journey with glaucoma. So early on, there is a lot of intensive care. We want to, of course, stabilize your eye pressure, which may take several rounds of coming back and back to check your pressure on different medications, maybe adding, maybe changing. So the first 2 years are intensive, and then once we stabilize, you really make sure you're stable, it becomes a bit more of a routine. So we just ask for your patience and grace initially as we get to know you and get, as you said, your glaucoma tells its story to us.
That's very, very interesting. Florian, you mentioned that you have multiple specialists. How do you ensure that they talk to each other? And what do you do if they don't?
That can be a challenge, and it's as much as, communicating to them, like, hey, I'm seeing Dr. So-and-so, and, they mentioned this, or, perhaps my visual field, like, for example, when I see my retina specialist, they don't do the visual field there. So I would say, my last couple of visual fields are good, and this is what they're seeing. And so just keeping, and every once in a while, you may request like a copy of your file or have them email it to the, I wish that there was better technology so they could communicate. That's a whole different topic. Yeah. But yeah, again, you have to be your advocate. You have to make sure that they're aware, like, I'm on this new drop, or I started, I had this procedure done, 3 months ago, whatever. So, yeah, it's really making sure that you know what you've communicated to a doctor and that they're informed, because all these things are linked together. So.
Carolyn, we have a question about what advice can you give other patients when it comes to dealing with the payer system or coupon programs and things like that?
Oh, I'm getting some fun ones. So I'll say that, so there are, for patients that are not, and if I say any of this wrong and one of the doctors knows it, stop me, right? If anybody else out here knows, but there are often, if you're taking a brand name drug, pharmaceutical programs that will help support your copay if you are a privately insured patient. So that includes you're insured through an employer or through the public programs, can't say the name of it, Obamacare, the marketplace, sorry. And I will tell you, I was on a brand name drug for about 10 years, never asked or questioned the copays. The generics are always cheaper, my eyes are always red. And so they're always trying to give me the least number of preservatives. For whatever reason, my doctor wanted me on the brand name drug. All of a sudden, I move, I go to see a new pharmacist. She says, aren't you a member of the blah, blah, blah copay program? I said, no, what is that? So it turns out a prescription I had been paying, I don't know, $100 or $200 a month for, there was a $25 copay. So then I got interested, right? Because I was on a couple of other brand name drugs. And I learned that, again, most of the brand name drugs offer this, usually without restrictions, except that it's not included for Medicare patients or anyone who's on any other sort of government health insurance. So that is a lot of exclusions, especially basically excludes everybody over 65. So I was a young patient. It was specific to me. I would say always go to the website if you're getting prescribed a new brand name drop. And see what you can learn. Talk to your doctor. They sometimes know. Sometimes my specialist has had those details. Sometimes they've been surprised. Sometimes it's a medical assistant in an office. A bigger practice might have a specialist. So you really do, again, have to advocate for yourself and ask those questions. In this one case, it was the pharmacist who was really aware. And I think maybe those programs have gotten more common across drugs other than eye drops in the last 10 years. Again, this was probably 10 years ago that it happened to me. But you should at least ask. And if there's other situations where I know if you're struggling to pay for eye drops, let your doctor know. There might be an alternative or there might be some sort of program or a way that they can figure out to help. So don't be shy about it, and certainly don't just skip taking one because you can't afford the medicine.
To continue that conversation, Dr. Pickering, let's start with you. Do you have any information on how to navigate insurance to get the best coverage, especially for patients that are on Medicare, Medicaid? Medicare Advantage?
Not really, not specifically, because there's so many different pharmacy plans and benefits. It's a really confusing landscape
Yes.
out there. I know that I think there's an annual sign-up period, either in November or December, and there is a tool online for the secondary insurance if you want to find out if the medicines you take are covered in different plans. So for Medicare people who have a secondary, in terms of picking the secondary or the pharmacy benefit, there is an online tool where you can enter your eye drops, your blood pressure, and just see if you can get a match as best you can. The problem within that is, my understanding is that all of the pharmacy and insurance companies, even if you sign up with this knowledge that, they're going to cover the medication, they can change that in the middle of the year. So this is why I really don't know specifically what to tell people. I just say, just do the best you can, and hopefully for the next 6 months, at least, it'll be covered. And then in our practice, I'm sure in yours as well, we try to do prior authorizations, tier reductions. We try to do what we can to assist our patients. And then coupons or Good RX, if some of the other programs out there as best we can.
Would you add to that?
No, I mean, thank you, Dr. Pickering. I think that was wonderful. Unfortunately, no.
I think it's incredibly frustrating.
So
the system is horrible.
Yeah.
Yeah, I mean, we do our medical. I would just, for those of us in private practice, we're very lucky if we have medical assistants who are great at prior authorizations, and they really do their best to get you guys the medications that we can. We're at our practice is in close contact with the reps for a lot of the medications, so we do get quite a bit of samples, and then the reps, because coverage can change like every 2 months, I've learned. You send it to this pharmacy, it'll be better. You send it to another pharmacy, it'll be better. And I try to keep close contact with the reps so that I ask them literally, my patient has this insurance, what's the best way for them to get the medication? And oftentimes they have little tricks here and there. So that would be my other 2 cents.
I hate to leave it on the system sucks, but a Florin or Carolyn, what, do you have a success story that you could share on how you managed to, you just shared your story of the coupon.
No, do I have that face again? No, because I'm in that situation right now. I'm on a brand name drug. I have a big, large insurance, and they stopped covering it, and my doctor's office is in the middle of requesting the prior authorization. So they're going to do their best. They'll help me out. If, fortunate if I have to pay for it out of pocket, like I need this drug, I'll stay on it. But no, it's incredibly frustrating, and you hear and see from the doctor's offices that they're dealing with it too. I mean, I want them spending the time talking to me, not fighting with the insurance company, but I guess it's the reality right now, and hopefully it'll, get straightened out somewhat eventually.
Would you add anything to that?
Yeah, I mean, I think that, like it was mentioned, some of these brand name drugs, they have these pharmacy coupons where you can get it for like a $30 copay, which is otherwise would be like several $100s. for certain medications. I think what's also helpful is to, again, as you advocate for yourself, sometimes you need preservative-free options, right? And insurance will refuse to cover those. So there's a bit of a battle with that. Sometimes, you can pay cash and go through like a mail-in pharmacy, and they'll send it to you, for a reasonable cost. But yeah, none of this is cheap, unfortunately. There's a lot of issues with that.
Let's stay with you, Florin. If you could go back in time to your newly diagnosed self, what do you know now that you wish you had known then?
Yeah, so in my case, and again, it's not everyone, but in my case, the progression of the condition was relatively quick in the beginning. So I would say that there has to be a sense of urgency, not panic, but urgency, as far as adhering to the protocol. And if you're told to do 3 times a day, sometimes I would skip the middle of the day or do it later. And that's something that I wish I was more disciplined in the early days. But the other thing is, again, follow up with your doctor and follow the protocol, because it's irreversible, guys. So it's important to preserve the vision that you have. And what I wish I knew is that, I wish that those procedures were done faster, that I had tried more things earlier on. But either way, I think it's, you learn from us and from others, and this is why we're here, is to share our experience. And but I would say, if I would leave one thing, is take it seriously. This is really critical to listen to your doctor and to follow the instructions, and you'll be okay. Most of the time, the vision can be preserved. So that's the good news.
Yeah, so I guess I'm a pretty good rule follower, and I, was really not missing drops or appointments or any of that. I've got a strong family history, so I started in the place that my maternal grandmother, had gone blind from glaucoma. My mother and one of my siblings also have glaucoma, although diagnosed after me. So I was very concerned from the beginning. I think what I've learned to do, though, is be more proactive and prepared for my appointments. At the beginning, I was kind of letting the doctor, and again, I had a great doctor. I really trusted the process. I was letting them drive the conversations. But once it became clear that my case was a little bit more complex, probably once I had to move for the first time and realized it was up to me to be, succinct but yet thorough in really explaining what we had done and what had happened so far in my medical or my eye health history. I don't go to an appointment without a list of anything that's changed about my own health or my eye health, any new symptoms, anything like that. And I always try to have a couple of questions in priority order. Sometimes, let's face it, if you're seen 2 hours late and you saw somebody coming out with an eye patch, or you can just feel there was an emergency or two, those happen, right? And that's been me, so you don't want to hold that against the practice, because you'd expect and want your doctor to take care of you that same way. So I try to put my questions in order, and hopefully you have time for a good 2 or 3 questions, 5 or 10 minutes towards the end of an appointment. If you don't, again, you can call to follow up, you could email, or you can ask it on your next appointment, depending on how quickly you're being seen. But I think I've gotten more prepared for my appointments over the years, and to me that's important.
Would either of you add anything on what you wish a newly diagnosed patient could know? You can't see all of them, but if you could, what advice would you give newly diagnosed patients?
Florin brought up a great point. When you're first diagnosed and you see really well, and you have to put a drop in your eye that stings and burns and causes your eye to become dry, it's understandable that you don't want to. You have a disease that doesn't have symptoms early on. And I've had some patients who, for whatever reason are non-compliant. It's not necessarily that I hold it against them. I just feel that they don't fully grasp the gravity of what's going on. And then I have patients I see later in the day who have severe visual loss due to glaucoma. And I almost wish I could introduce the two of them to each other so they could understand what can happen 20 years down the line if they don't take care of their disease now. There's really no way to do that, but I do give these kind of examples to my newly diagnosed patients who are finding it very difficult to use their drops as they're supposed to, or who, are experiencing side effects that, are mild and treatable versus intolerable, if that makes sense, but it's just kind of a new adjustment, and I just caution you just to take it seriously.
Yeah, I agree with you, Dr. Barsegian. You do want to take it seriously and also, again, recognize that this is a life sentence. I tell people it's kind of like high blood pressure. We don't have a cure, but we have excellent treatments. We want to get your pressure controlled and have you live a long, healthy life. And like any other condition, the earlier we diagnose, the earlier we get your condition under control, the longer and healthier you'll live with it without any impact really with your vision. And that's the goal.
Dr. Pickering, when a patient changes from your service and switches to somebody else, do you tell each other why the person switched off?
Sometimes I don't know
Okay.
why, which is absolutely fine. I mean, most of the time, especially in the Bay Area, it's because people are moving around. There are a lot of people in tech or education, and they're just going for different jobs in different parts, which is completely reasonable. Or they're retiring and moving to the country or different senior living situations. So I was always just very open-minded, and I always try to assist the patient. Occasionally, the patient is switching because for whatever reason, our practice isn't able to meet their needs. And that's perfectly fine also. We are a small practice. Some people have many concurrent eye diseases. They may need to see glaucoma and retina and cornea, and they don't want to go to 3 different private practices. They may want to go to the university. And I'm like, that is completely reasonable. And sometimes I will communicate to that physician if I know them, like, hey, so-and-so's coming through. This is what you want to look out for, and that is appropriate. It is not a breach of HIPAA because it is in the interest of the patient's care. So if your doctor is talking to another doctor about you, it's because we care and we want you to continue to have good health and good eye care, and we will always, of course, send all the records, sometimes 2 or 3 times because they get lost in some of the institutions, but we will, that's why we do what we do. Yeah.
Great. Dr. Barsegian, yesterday I met a woman who goes to a large group here in California, but her glaucoma specialist just left, and there is no other glaucoma specialist available at that practice. But thanks to insurance and difficulties navigating, she kind of has to stay there. So, what do you tell a patient if they don't have access to a glaucoma specialist, either because someone left or maybe they live in an area where they don't have someone of the caliber of the people in this room to go see?
First of all, I'd actually encourage them to go on AmericanGlaucomaSociety.com because Dr. Pickering and I are both members of the society. There's a small group of us in the country who you have to get nominated because you primarily provide glaucoma care. And there might be more of us than you think, actually. And I would actually encourage you just to look there, see which glaucoma specialist might be practicing near you, and give them a call and see what you can do. If you truly are in a situation where you have nobody around you, I do think it's important if you have significant glaucoma, especially to see a glaucoma specialist maybe once a year or twice a year. So I have patients who travel to me and I co-manage their care with a primary ophthalmologist who's local to them, and that has worked out really well. Otherwise, I would say if you're going to see a non-glaucoma fellowship trained ophthalmologist, at least see somebody who sees a lot of glaucoma in their practice. That would be my other recommendation.
I'm going to ask Dr. Pickering one more question, but my final question for all of you is going to be, what is one thing that you wish our audience would take away from attending this patient summit today? So think about that. And Dr. Pickering, I want to ask you, your clinic does a lot of clinical trials. If a patient enrolls in a clinical trial, who should they talk to? Should they be telling their primary care? Should they be telling maybe the other specialists that they see?
Sure, and they can tell anyone that they're in a clinical trial, other patients, family.
It's like a recommendation, though.
Yeah, in terms of sharing information, it's fine to tell the other eye care specialists that you may see, your optometrist, your primary care doctor, that's okay. depending on the clinical trial, though, and we don't have any of these right now, you may be getting an active component, but you may also be getting a sham. So that's ultimately, if you do tell the whomever, you need to explain that to them. And if you have any unusual side effects or anything that new that crops up while you're participating in a clinical trial, you want to definitely tell the primary investigator. You need to let the team know so they can really carefully document that.
Okay. Who wants to start? What do you hope that people take away from attending this patient summit today?
Well, I'll start. And I think for the two-day summit, what has been very encouraging to me is that there's a lot of hope, a great deal of hope, a lot of research being done, a lot of investment in taking care of you. We want you to take good care of yourselves and spread the word to your family members. From the minute we start to take care of you, no matter what stage you're at, we're going to do everything we can in our power to help you take care of yourself and maintain your sight. So there's a lot of hope.
That's hard to follow up because I am just personally so thankful for all the doctors who are giving up their weekend, other time in preparation, planning for this. I sit on a couple of the GRF committees with Dr. Pickering, and she goes to clinic all day, and then I don't know what time it is in California, 4 or 5 o'clock, 6 o'clock, whatever. She's on a Zoom call with us talking about planning the patient summit or the newsletter or whatnot. So there is a lot of hope. I would say, for me, the takeaway is there's no one responsible for taking care of your total health, including your eye health, except for yourself. But if you're somebody who's very independent, likes to think they know the answers, knows what to do, don't just assume that. You need to reach out. A lot of us struggle with the stress of this, with the mental health challenges of being diagnosed. Again, I was 38. I was worried about it, nonstop. I didn't really want to tell people that. I didn't want to worry my husband. I didn't want to worry my parents. I didn't want to be too scared, but yet I was concerned. So, find a group, a person, a forum, somewhere to share those concerns. And I personally find it's amazing how much better you feel and the perspective it gives you when you just really talk about both the good and the challenges of being a glaucoma patient.
Well, I think the first takeaway is that obviously you're not alone, right? Look around the room. There's so many of you. There are many more patients in the country. And as your physicians, we are here to support you, to advocate for you, to take care of you, to keep you seeing. In some ways, you are very lucky because prior to, I believe, the first PGF drop, Dr. Pickering came out in 1997, if I'm not mistaken. And prior to 1997, the only options we had there were 2 drops for glaucoma, 2 surgeries, and an oral pill that makes you sick. So in the last less than 30 years, I guess, we've had incredible breakthroughs in this field, and it's become, it's a joy to do what we do, but it's just so much more uplifting, I think, for us in our field now than it was 30 years ago. And as patients, as you're going through this, there's only more coming out. There are only more drops coming out. And we've made really huge breakthroughs in the past 30 years. So, don't just kind of whenever you're upset, just remember that and kind of help that keep it all in perspective for you.
Yeah, I would echo everything that was said. I think, the first thing is you're not alone, and there's a community, and there's people who care, and there's all these scientists and doctors and researchers that are working really hard and I've met some of them at several GRF events, and it's just amazing to see, the potential out there for a cure, and I'm hoping that in my lifetime I'll see, that, and just feel free to reach out. There's a wealth of information on the GRF website. There's a YouTube channel. There's other, physicians here have channels where you can listen, get answers to a lot of these questions, and just empower yourself with information and ask questions and be hopeful. I think that's really the theme, is that there's a lot of opportunity for a cure, and I think we're going to see it very soon.
Wonderful. Thank you all. Let's thank our panel. Excellent. I do want to note that throughout the day, we have received some very case-specific questions, and I can completely understand why some of you out there would want to know something specific about your individual condition. I get it. I hope you understand why maybe I wouldn't ask that question in this large room, but we do have a reception coming up. We have our fabulous doctors are going to be staying around, so I encourage you, we're not ignoring your question, we're just trying to get to things that maybe will be a little bit more applicable to members of the audience. So please don't be discouraged. Ask your question, just maybe in a one-on-one setting. So with that, thank you guys so much, and